this from outer to inner, like this. Okay, just to get this off, I'm going to have to put my hand here. Well, I'm just going to take that whole thing off right there. Anyway, put it in my gloves. So to answer your question here, I wanted to show you two different things. Like when you're working on this, when you're working on the outer part of it, it's okay to use non-sterile gloves, but sometimes you get to something right like I did right there, and you're like, I probably should have sterile gloves for that. So what I usually do for something like this, I'll take an extra pair of sterile gloves in, and I'll open it, and I'll use it for the outside, and then use another one for the inside. And especially when you do wound care, you might need 2 or 3 pairs of sterile gloves. Okay, so you're going to take the sterile gloves on the edge here, and then this. These are kind of big, but that's okay. Is this sterile right here? Yes. Okay, so this is sterile, so I can kind of look and see what's going on here. I don't want to really hang over the sterile area. And you guys have a training pack, so it's going to have 2 of these in it instead of 1 like the norm. I'm going to take this out, and I'm actually going to use this as my trash can. So your trash can should not be on the sterile field. It should be to the outside of it. Does that make sense? Okay, so now I'm going to, or you can do this too. You can use this as a trash can, open it up like this, and put your stuff in it. What I do a lot of times, you don't have to do exactly like this, but a lot of times I'll put my stuff in here and then put this in here at the very end. You don't have to do that, but it's just another way. You just want to make sure that your trash, wherever it is at the very outside area. So the next thing I'm going to do is I'm going to peel that from one side to the other and just twist it around. And it's full of alcohol, so you want to pour the alcohol out so it just doesn't get all over your sterile area. Does that make sense? Okay, so have I contaminated my hand yet? No, not yet. So at this point, this finger right here, I'm going to set this finger down right there to stabilize it. And I'm going to take this little swab that's alcohol based, and I'm going to start from the port of entry, which is right there. I'm going to start, and I'm going to pull the germs away from it, kind of like a rainbow fashion. And as I do that, I'm going to twirl this, so I'm twirling it to a clean area. Does that make sense? So I'm going to pull the germs away, and then instead of going over the sterile area, I'm going to go around the sterile area towards myself, not around the sterile area that way. Does that make sense? So around the sterile area and drop it. The same thing with the next one. Start at the port of entry and go around, rainbow fashion there. Go around here, and one more time. And around, and I'm going to take this. There's an alcohol swab next to that arm. Just put it on here and we'll pretend like that's sterile. This is a used kit, so it didn't have everything in it. So with my dominant hand, I'm going to pick this up and I'm going to open it in the middle. So what I'm doing with this hand, I'm keeping it stabilized. I'm not passing my dirty hand because it's kind of sticking to the patient. I'm not passing this hand back and forth over the patient. Does that make sense? Okay, so at this point, this is clean. I'm going to take this and I'm just going to slide it underneath this area to get that clean underneath there. And so it's clean up there and it's clean underneath. I'm gonna do that. So now it's all clean, and you can take the, do you guys remember what this is called? A slit or a split dressing? If you use it, you will use it like that, not like this. That doesn't make sense, okay? You would use it like this. That's what it's designed to be used. But most of the time, the doctors want to be able to see that point where it goes in, and the nurses to make sure that it's not red or infected or anything. So most of the time you don't use this. Okay, so we're not going to use this unless it's specifically allocated to do that. So the next thing we need to do is put something on top of this, which I don't have a Tegaderm in here, so I'm going to have Anthony take one out of here and open it, like roll it back so I can get it out sterilely. So just take one out of there and roll the edges back for me. So that way I can take it just like that. And it probably doesn't make that much difference, but if you will do things the same way every time, you don't have to remember. But see that little end that opens? Do you see that right there? I don't know if you can even see that with a dark background right there. I put the open end the same way every time. I do it the exact same way every time so I don't forget. It's just a tiny little thing. It doesn't really matter. I just do it the same way every time. And at this point, is it okay that I'm not sterile anymore? Yeah, it is. So I'm going to peel this off. And you see I didn't put it over the tubes that come out. I'm going to peel this off. And all of your Tegaderm should have a little thing that you can write on right here and put the time you changed it. It's really hard to do that with these gloves on. And then put that on there. And I don't put it over this because I want to be able to see how it looks. So that's how you change. It's just a glorified dressing change. You have to have really sterile technique on that. So does that make sense to you guys? All right, and then these little holes right here, sometimes if they don't have that round little disc that I peeled off that helps it stick on, sometimes they'll suture it into the skin with these little holes to keep it from coming out. And then if you're ever asked to assist with removing one of these, the doctor usually comes in and removes it, and you stand there with a gauze, sterile gauze, and hold pressure for about 20 minutes to keep it from having a hematoma. And don't fudge on that 20 minutes. Like, stop everything, get someone else to take care of your other patients, watch the clock, sit there, watch TV with them. Don't fudge on that because you do not want them to form a hematoma there. Are there any questions on that? Okay, a couple other things is sometimes people are sweaty, and so they have extra tape in here that you can use to kind of tape around that. And it should come with, sometimes it comes with a couple little extra swabs that you can use in cleaning. And this is a better name thing. I just used the one that was on there, but here's a real name thing. So, okay, since I went over it with you, I'm going to ask you guys some questions.